Okay, so here the patient had sudden onset headache with a very severe headache. He is rating it on a scale of 10. He is saying that it is 9 out of 10. That is a very severe headache. It is accompanied by neck rigidity and photophobia. Now you might say, sir, this is a case of meningitis. Remember here, the headache is sudden onset, and meningitis headache generally will not be very severe. Here it is extremely severe headache. That too, onset is sudden and not acute, right? Like it does not evolve over hours. It is just like in terms of minutes, the headache is evolved. So it is a sudden onset headache along with the evidence of meningeal irritation. What should come to your mind? Obviously, I should think about subarachnoid hemorrhage. Okay. Unfortunately, the CT could not identify the subarachnoid hemorrhage in this patient. But I still think that this could be a case of subarachnoid hemorrhage. Now, how would I proceed further? Ideal investigation would be to go for lumbar puncture, where we can document something called as xanthochromia. Yellowish discoloration of the CSF. We call it as xanthochromia. It is because of, if there is a subarachnoid hemorrhage, in the subarachnoid space, there is RBCs released into it. Those RBCs will get lysed, releasing the pigment, and that gives the yellow discoloration to the CSF called as xanthochromia, which you can appreciate in this image, right? The normal CSF, you can see a clear watery kind of fluid, and here you can see yellow tint to it. This is what we call as xanthochromic CSF, which can indicate subarachnoid hemorrhage, especially in the right clinical context. In this case, clinically the diagnosis is subarachnoid hemorrhage, and once I do CSF and it confirms xanthochromia, my diagnosis is done. So I will go for lumbar puncture as the investigation here. Thank you.